Very good morning to everybody. I, Dr. Syed Mohd Razi, consultant endocrinologist from Moradabad city, in Uttar Pradesh. And I would like to draw your attention on the early and impressive management of type 2 diabetes mellitus, as this disease is becoming a pandemic, and India is becoming the capital of this pandemic. And we have a very long disease in the form of diabetes, where hyperglycemia leads to comorbidities, and there is a term called bad glycemic memory or bad glycemic legacy that is due to epigenetic changes that occur with long term of hyperglycemia. Because most of the cases we see physicians inertia or the patient's inertia, they start with dietary and lifestyle modification as the first management, then 3 months pass, then metformin, then sulfonylurea, and meanwhile the bad glycemic memory is getting deposited in your body, and there are changes that are revealed in the form of either nephropathy, retinopathy, cardiomyopathy, CV events, or heart failure. To prevent all these things, it is better to act aggressively and swiftly and to the target. And one of the important things of hyperglycemia management in diabetes, that any drug which is used should hit every pathophysiological aspect of omnious actate or egregious level. Then there should be a simultaneous scope for reduction of weight, blood pressure, and there should be some improvement in the comorbidities. Simultaneously, there should be a scope for having no or very less event of hypoglycemia and other side effects. So empagliflozin and linagliptin as a combination has emerged, very good combination, I would rather say, in a single pill that considers for all. It has an impressive glucose lowering effect, number one. Then it causes reduction in weight, reduction in blood pressure. It prevents the CV events. It prevents the 3 point MACE, and it reduces the chances of heart failure. Simultaneously, it reduces the microalbuminuria, and it causes very less hypoglycemia. So if we have a patient, suppose Mr. X is having diabetes of 4 years of duration, he is having hypertension of blood pressure, say 140 on 90 millimeters of mercury. He has a family history of diabetes, coronary artery disease, and diabetic nephropathy in his father and mother. And now he is having a HbA1c of say 8.5, and he is on metformin therapy along with medical nutrition therapy. How to bring his A1c to the target swiftly so that there would be no bad glycemic legacy, and we can save his health from the negative aspects of his heredity in the form of coronary artery disease or chronic kidney disease. So the answer lies in this combination, that is linagliptin and empagliflozin. It simultaneously reduces the A1c level to the target of this particular patient to the tone of say 6.5 to 7 from 8.5. Then it causes reduction in his blood pressure. Then it reduces the chances of getting a heart attack or reduces 3 point MACE. Simultaneously, it reduces the chances of getting CKD. And we have some cost saving also, because if we have two separate molecules, then the cost is increased by up to 30%. Then obviously, the confidence of the patient gets increased by getting a single pill. Patient always thinks that I am not a failure. My diabetes is well controlled on only one or two pills. So if we are giving separate pills, the patient is always have a compliance issue. Third and the most important aspect, that if we are dealing with a young diabetic patient who are having the productive economic life, there could be severe hypoglycemia because of the erratic lifestyle and diet style, as is happening in today's society in corporate culture. So this molecule is mostly just having no chances of hypoglycemia, or we can say it is having a protection against hypoglycemia. The hypoglycemic events are very less. We see in most of the cases, once we are using any potent drug, then there are good chances of getting hypoglycemia, and hypoglycemia is such a thing that nobody wants to have. So, in nutshell, I would like to say that this particular combination carries all the benefits which we want to gain from the patient of metabolic syndrome. What weight reduction, blood pressure reduction, cholesterol reduction, 3-point MACE reduction, and simultaneously good glycemia control. But a word of caution is that the patient profile should be selected very carefully. Those patients who are having recurrent UTI, GTI, BPH, impacted stones, we should just check for their renal functions and their sonographies and their urines before advising this molecule. Then those patients, we are not sure about that we are dealing with type 1 diabetes, late autoimmune diabetes of adult, or maturity onset diabetes of young, or we are dealing pancreatic diabetes, we should refrain our approach from getting this combination, because this is a hardcore combination for type 2 diabetes, and type 2 is a diagnosis of exclusion. So, if we are choosing our patients cautiously, and definitely this is a miraculous combination, this is a panacea for diabetes. And one of the most important aspect is that the durability of glycemic control. Usually, if you give sulfonylurea or some other drugs, the durability of glycemic control is not very good. So, with this combination, the durability can be like 4 years, 5 years, even 10 years, because it affects multiple mechanisms of omni octate at the same time. So, there are very less chances of getting side effects, and there are very potent chances of getting durable glycemic control. Thank you. Thank you.